Welcome to the Safeguarding Podcast. In each episode, we'll discuss a different safeguarding topic with a range of expert speakers. Please be aware some of this content is sensitive and listener discretion is advised. Hi, welcome to the Safeguarding Podcast. I'm Melanie Harding and I am the Head of Marketing and Communications for the Safeguarding Company. So I'm here today with Jo Godsal, and Jo is the Clinical Director and also the DSL Lead for Chroma. So Jo, welcome to our podcast.
Hi, thanks for having me.
No, more than welcome. And if you could just tell me a little bit about Chroma, what you do and what the function is. What's your primary function?
Okay, so we provide art therapy, drama therapy, and music therapy across the UK. We've got over 100 therapists, and we work in all sorts of settings. So we do lots of work in neuro rehab, so working with people with brain injuries, and then lots of work across social care and education. So it's that range of settings. And whilst our neuro rehab work is slightly different, the majority of our work is working with young people who've got complex histories, who've experienced trauma, neglect, and as arts therapists, we can help young people to explore, to express and process those experiences using art therapy, music therapy, and drama therapy. And I guess one of the nice thing about the arts therapies is that we're not expecting these young people to be able to put into words or articulate verbally exactly how they feel or what their experiences were, especially when often these things have happened at a very young age or pre-verbal levels, but instead they can use the arts as a way to explore that and express that, held all the time within a therapeutic relationship.
That's really interesting. Thank you, Jo. And you're a My Concern customer or a Safeguarding Company customer, should I say. So you use at least one of our products. I think you use more, actually. So that's really interesting. And I think you were actually one of the early adopters of My Concern. So you came on board, I don't know how many years ago now, but a fair few.
Yeah, a fair few, absolutely.
And,
Well,
and
and I guess the reason for that is that when I first came to Chroma, I think we were doing a decent job with safeguarding. I think in terms of the way we dealt with issues, it was pretty good.
Yeah.
But we had no way of actually properly centrally recording it and following it.
Yeah.
And so there was an awful lot of, stuff being dealt with that was then lost in the files, frankly. And the reason that we came to My Concern was that ability to have a central eye on things, to be able to follow things from the beginning through to the end.
Yeah.
Often when there's a safeguarding event, there'll be lots of action at the beginning. Everyone will be, we need to do something about this. But then the follow-up, the bit that says, right, what's happened next? Have we actually brought this to a close? Have we done all the things we wanted to do? And that's that's where moving from, the various systems that we're using at the time to using something like My Concerns, just really important to be able to properly have a sense of what it is that we're doing with our work.
Absolutely. And I think that element of, documenting reasons and rationales for things, so you might have to jump back again and time again. It might be years later that you have to revisit something, but having an understanding that you put a rationale in for the reasons that you did that is really important. So that's really interesting.
And I think the other thing that's really useful actually is it means that you don't lose good practice as well. Is that you make sure that you're doing the good stuff, the good work that you're doing all the time, rather than just, that was a really good bit of work. You can look at it, you can learn from it.
Absolutely. Brilliant. So I understand then that a lot of the work that you do is with schools. So that's a mixture of mainstream, SEN, all sorts of different schools. So can you tell me a bit more about that? What do you do in those settings?
Yeah, absolutely. So we work both directly and indirectly with schools, by which I mean, a lot of our work is local authority funded, especially our work with adopted children. And often the school will host that bit of work. But we also do a lot of work directly commissioned by schools. And yeah, you're right. We work both in mainstream and within special schools, SEN. So within mainstream schools, there's a huge range of what we do there. Sometimes it's well-being, social skills. But
Mm-hmm.
actually, we also see really complex cases within mainstream, whether that's young people who have diagnoses, it might be ASD or ADHD, um, or we have a lot of young people that don't. And, we know that CAMS waiting lists these days are really, really long. We know
Yeah.
that the support for these young people is really, really stretched. And so a lot of schools bring us in because we're able to start working with their young people and help them actually to be able to function better within schools.
Yeah.
We also do a lot of our work is with looked after children in
Mm-hmm.
mainstream and obviously pupil premium students. And again, it's looking at what are these complex histories for these young people. We see a lot of attachment issues and attachment in the
Mm.
classroom. It's something we talk about a lot, but teachers absolutely know when they see attachment difficulties
Yeah.
in the classroom in terms of how these young people are able or not able to function. And so we're able to start the work with that to hopefully enable them to access their to access education. And like I said, we also do a lot of work in special educational needs, and that's across the whole range. So we have we work with PMLD, so profound and multiple learning difficulties,
Yeah.
all the way across the spectrum to very high functioning.
Mm-hmm.
Again, autism quite often, and everything in between. So, for instance, we're working in a trust down in the southwest across 7 or 8 schools where absolutely that's an SEN trust, and there's a whole range of need there. But we've got arts therapists in each school working in
Yeah.
different ways depending on who the clients are and how
Mm-hmm.
to best meet their needs.
Yeah. So that's really interesting, and I think just using that medium of arts, and it's a whole multitude of different arts, isn't it? As I understand it, it's not just
Yeah,
art as in
no,
art.
absolutely. So we've got art therapists, drama
Yeah.
therapists, and music therapists. But within that,
Mm.
there's a huge range. So as a music therapist might be working with somebody, and we're just looking at using rhythm. So just very simple percussion work,
Mm-hmm.
helping them to think, helping them to respond in a relationship.
Mm-hmm.
Where's the back and forth within music making and improvisation? Where's the ability to take turns, to follow, to lead, that actually are right there at the bottom of social relationships, but also a lot around regulation. Can I get myself really excited and bring myself back down and look at
Mm-hmm.
things like that? But a music therapist might also uh, be working with another client where you're looking at songwriting as a way to explore feelings, and actually
Yeah.
you're creating music online using something like GarageBand and songwriting and things like that. So
Mm.
it can be that whole range of within music, and again within art therapy and drama therapy, it can be working with. I'm a drama therapist.
Yeah.
That's my approach. So I've worked with some really quite young clients. I've worked with some really quite young children doing a lot of projected play. That's using figures, using dolls, things like that to help people
Yeah.
to play around and explore their own stories. But equally, I've worked with teenagers who have a very different way of exploring their story.
Yeah.
Um, and of course, the other nice thing within the way that we work is it can be very, it can work in the body. Something that we hear a lot about when we're talking about things like ACEs,
Mm-hmm.
um, adverse childhood experiences. We know that has a real impact, cognitively, but we also know it has a real impact physically, and trauma. It's quite common now to talk about the fact that trauma is held in the body. But if it's
Yeah.
held in the body, how do we access that, and how do we process that? So we can work really very much with that, with the body and with expressing and exploring the work through that.
Definitely. It's really interesting, and I imagine that you would obviously tailor what you do depending on the age of your you, your clients, I suppose, as well.
Yeah, absolutely. If there's one thing a teenager doesn't want to be patronised. They don't want to be made to feel like they're really young. But fascinatingly, we work with a lot of kids where we're working with 2 children at once. We're working with the child at their chronological age,
Yeah.
and we have to really respect that and make sure that actually this isn't babyish or silly. Um, but actually, often we're working with the much younger version of
Mm.
themselves as well.
Yeah.
That part of them that was, uh, you know, neglected perhaps at a very young age and has those real to have that small part of them looked after as well. So, working with, tailoring the work to cover both of those elements within the session is really important.
Definitely. Brilliant, thank you. So you've touched a little bit on it already, but how does the work you do specifically relate to safeguarding and well-being? Can you kind of unpack that for me?
Well, I mean, therapy, safeguarding is at the centre of everything you do as a
Yeah.
therapist. We have to make sure that the work is set up safely. We have to make sure that our clients are safe to do that. It's the first conversations that you're going to have in therapy with a client are going to be talking about confidentiality.
Mm-hmm.
Confidentiality is really important for therapy, but also the limits of confidentiality, which is being really clear about actually where safeguarding comes in, what the boundaries are, what the lines are, and when we're going to need to go and share these things with other people.
Mm-hmm.
Within our work, sometimes therapy brings lots up,
Yeah.
and we will have clients talking to us, disclosing things to us that we then need to bring to the multidisciplinary team working around a child.
Yeah.
Interestingly, sometimes the disclosures won't happen in therapy, but the work and the processing that's going on in therapy will enable them to then talk to those trusted adults, perhaps in school, who they can then disclose there. So,
Mm-hmm.
so sometimes we've got it happening in therapy. Sometimes therapy's enabling it to happen, with the pastoral lead, with the teacher,
Yeah.
with whoever it is there. So, in all of those events, it's about working really, really closely with everybody around a young person. Um, and a big part of therapy as well is the fact that a lot of the time we're managing ongoing challenges together.
Mm-hmm. Yeah.
Um, we've been kind of post-pandemic, the number of safeguarding concerns that we get recorded has tripled. There's
Yes.
a huge increase in the amount of safeguarding that's coming up. Um, and I was looking back at the kind of the last 6 months, and about a quarter of all our safeguarding concerns are around self-harm. Self-harm's a
Really.
real issue that we're dealing
Yeah.
with. But when you're dealing with self-harm, it's about an ongoing management of risk,
Mm-hmm.
which means that you need to be working really closely with the school, with the parents, with the social worker. And we do a lot of safety planning and bringing families and schools in there to help come up with a safety plan on how young people are going to be able to manage those feelings that are coming up that
Yeah.
are leading to self-harm, but also how they're going to manage if there is some self-harm, how the parents are going to know when they need to intervene,
Mm-hmm.
what's manageable. And I think self-harm is such a challenging thing for all professionals, because often
Yeah.
it ticks along at a almost manageable level, but that's really anxiety provoking for all the professionals as well as for the young person. So we're doing two things. We're trying to work with what the message is,
Mm-hmm.
what is being communicated, what are the feelings underneath here, and that's being addressed directly in therapy. But we also need to work really closely with the team around that young person, with the family, with the school, to think, okay, but if they're doing these things, how are we going to do this? How are we going to look after them? How are we going to keep them safe?
Yeah.
Who's got eyes on these different things? Who's there to understand, are things escalating? Are things under
Mm-hmm.
control? As well as doing a lot of, sharing of safety plans, like I say, but also, there's lots of resources out there for helping young people to find alternative ways to deal with things. So
Yeah.
that safeguarding is central to what we do, but actually, I think at the moment that self harm picture is really big for us, and it's been it's been useful to see just how prevalent it is, and it means
Mm.
we've been able to really look at, right, what are our resources for our therapists, and
Mm-hmm.
what are the resources that we can share with with teachers and with families. What's our guidance, and how do we then best work with and support these young people?
Absolutely. And I suppose from the school's point of view, if they're using a case management system and they can monitor that, if self-harm, for instance, is a big issue in their school,
Mhm.
then they can track and monitor that. And if they're, it seems to be unmanageable, they can get experts like yourself in, to come and address that. And, because they're not always going to have those expertise in the
Yeah.
school, are they, or in their
Well,
setting?
absolutely. Yeah, and like I said, it's that combination of how do we both work with what's underneath, what's getting
Yeah.
communicated with, unpicking why this young person is self-harming, what's being communicated, as well as dealing with the, keeping them safe.
Yeah.
And that, and I think it
Absolutely.
absolutely it takes the team, and it takes, and it does take that extra expertise.
Definitely. Definitely. So, Joe, you mentioned earlier, you touched on ACEs earlier and adverse childhood effects, but I suppose it'd be really interesting to know what the benefits or the positive effects of art therapy and what they can have on children that might be coping or with the trauma of ACEs.
Yeah, absolutely. Yeah, I mean, ACEs are so common. We think that about 60% of the general population, research tells us, have
Gosh.
been affected by ACEs or trauma. Um, but obviously, it's where there's that combination of multiple adverse childhood experiences that we see a
Yeah.
real impact. And we see that, um, you know, on child's development, on the impact on cognitive development,
Hmm.
how it affects neural pathways in the brain and the physical and emotional behaviours. Um, we actually see it in terms of health, so the impact that it has on the immune
Yeah.
system. And when a child's cognitive development is challenged, their ability to rationalize, to process information, and to make positive decisions is hampered. And that can mean that they're not able to verbalize the feelings that they've
Hmm.
experienced during the trauma. And instead, they hold those feelings within the body as reactions to seemingly unknown stimulus.
Mm.
A lot of the time, it'll look like a young person has, you know, behaved completely. Why on earth did they do that? There was nothing going on. But what's happening within their brain is that they're picking up on perhaps a threat or a fear, um, that might not well be there.
Yeah.
But because of their early experiences, they're hyper vigilant for anything that might mean that
Mm.
there is going to be a problem there.
Yeah.
So
Perceived threat.
yeah, absolutely. So their ability to make safe decisions in interactions is reduced. And of course, we know that there's those negative attachment relationships that a lot of our young people might have experienced. So, they might retreat into ambivalent or anxious attachment
Yeah.
strategies. So, where we then bring in the arts therapies is to then find a positive way to connect with those embodied feelings
Hmm.
and to rebuild those attachment experiences. So, for clients, that emphasis on speaking about your feelings is taken away through the activities of music or drama or art.
Yeah.
And those activities and resources that are provided by a creative arts therapist then provide a way for the client to express their internal feelings in a meaningful way, but also in a way that's not overwhelming. That there's a little bit of distance, there's a little bit of space in between them and their feeling, because it's there in a story, it's there in a
Yeah.
piece of artwork, it's there in a piece of music that they've created. So those activities, so that song, that painting, that provides a unique metaphor for how the client's experiencing the world.
Yeah.
And then as a therapist, we can bring that consistency by being really present with the client, by modeling a positive and transitional attachment figure for the client.
Yeah.
And as trust is built between us, this strong therapeutic alliance is created where the client can then move their experiences from internal to external,
Hmm.
which then helps them to reduce. We're looking at reducing shame, we're looking at reducing negative feelings, bringing acceptance to the client.
Yeah.
Acceptance is really key to reducing anxiety and that physical and emotional pain caused by trauma.
Yeah. Gosh, it's such a complex subject and topic when you
Mm.
really start to dive into it. It's really interesting. And
And it is. It's really complicated, but there's also some really simple stuff at the centre of it.
yeah.
Right. We are working with really complex mental health challenges, but at the centre of it, we're providing a relationship that
Mm.
feels supportive and safe. We're providing a way to be in relationship in a safe way through the creative
Yeah.
process, and we're also providing a way to unpack and process and interact with those difficult feelings in a way that feels
Mm.
safe by putting them into, you know the artwork. And it's interesting, and sometimes in the work it can be really reflective. So a young person might paint a picture and then sit there and go, yeah, that's me, that's mum, and this is what that's about. And and that's great. That's really effective. And actually, sometimes it can stay within the creative metaphor rather than need to be specifically said. So sometimes it might be just that process of putting out those feelings onto that piece of paper within art therapy, and having them there, and not having to then unpick them and explain everything about them,
Yeah.
can also be really effective.
Yeah, and I suppose it's allowing them to do that in a positive outlet as well, in a positive forum, in a way that's safe and not going to be in their own time or on their own or in a destructive manner. It's
Absolutely. And so much of it is having all of those thoughts and feelings witnessed. Somebody else is there. Somebody else sees them. Somebody else validates them.
validated. Yeah.
Absolutely. And then, maybe somebody then thinks about, well, okay, and what does that mean? How does that impact on your relationships? How do you then see that in within your day-to-day relationships? What's happening there in class that you're getting so anxious that you can't think, that you can't access teaching, or a lot of the work that we do, well, it's always, we'll have referral aims from the teachers, we'll have referral aims from the school, from the parents. Those are really important. But actually, really important are the goals-based outcomes that the young people come up with.
Yeah.
That they're saying, right, this is what I want to change. This is what I find difficult, and this is what it would be like if things were better and things were different. And really helping them engage with that sense of, I can enable some change here. They work really hard in the arts therapies.
Yeah.
Sometimes it might sound to the person walking past the room like there's a lot of fun being had in there, and
Yeah.
there really can be, but it can be really challenging. And we're asking a lot of these young people
Yeah.
to really get in touch with their thoughts, their feelings, and their emotions, and to work with them.
Yeah. Oh, that's great. It's really good. It's really good to hear about. Um, So, are there any when we were talking before we had a call pre this, and we were discussing around the work that you do and about how you use my concern in your setting? Are there any real life scenarios, obviously anonymised, that you can maybe tell us about that my concerns help improve the outcomes for any of your young people or children?
Yeah, I was thinking about that before we came on. I was thinking, self-harm, like I say, is
Yeah.
a really important part. That being able to look at everything that's coming on my concern and go, right, this is where we need to target our resources, our guidance, um, and also, like I say, that process of seeing things through. Um, whenever new people come on board, obviously have safeguarding induction and things like that. And I always say, I always make the same slightly terrible joke. I'm always glad that it's called my concern and not my major safeguarding incident, um,
Yeah.
because it's so important that we're using it to share those small concerns, the things that might not require further action. But
Yeah.
what it does is it creates a culture where we're able to look at things and talk about things, and not just have the therapist or the teacher or whoever it is holding
Yeah.
on and wondering about these things, but instead, no, let's share that, let's think about that. Maybe it doesn't need to go any further.
Yeah.
That's fine. But creating that bit of distance, creating that bit of perspective
Yeah.
with the safeguarding lead, I think is really important. Um, and I think it's about creating a culture of being able to think and talk about things that can otherwise feel unthinkable or taboo.
Yeah.
And I think having a process helps you to step back, to bring perspective, to make the right decisions. Um, and absolutely, we then have a clear process that if we do need to show to share things, if we do need to take actions, we can have really clear process and an understanding of why we've made those decisions. um, in terms of examples, I was thinking about a case that finished really recently, um, where we had a lot of concerns over a long period.
Okay.
I think, again, it's that process of being able to see, right, what's happened over time with this
Yeah.
young person, not just with the individual concerns, but with the multiple concerns that came up. And it was one of those cases where, there were a lot of professionals involved. They were under a child in need plan,
Mm-hmm.
but there were just so many regular changes to who the social worker was.
Right.
It was working within um, a local authority that actually had gone into special measures. It
Yeah.
was a little bit chaotic. It was a little bit wasn't the best, I would say, in terms of the way
No.
that the practice that we've seen, and we had that real sense of there was little sense of what was happening over time
Okay.
because we had new people coming in all the time to manage this case from a social work point of view.
Mm-hmm.
So every time there was an incident, that crisis was dealt with in isolation.
Yeah.
So what we had to do as an organisation is step in and challenge that and say,
Yeah.
look, let's show you what's happened over the
Mm-hmm.
last 2 years. This isn't a one-off. These are a series of ongoing incidents. This is how they're linked. These are the things that were done. These are the things you've already done. So there's no point
Mm-hmm.
in us trying to just do the same things again.
Yeah.
Um, and it was so helpful to be able to really bring that evidence, that audit,
Yeah.
that trail that said, this is the story of this young person that you're forgetting because
Mm-hmm.
nobody's holding that story over time, whereas we have been holding it over
Yeah.
time, and we're able to show that, and we were able to get the IRO, the independent reviewing officer, on board to get
Yeah.
decisions made, and it was a sad ending in many
Yeah.
ways because the young person wasn't able to stay at home; they had to
Yeah.
move into foster care, but ultimately it was about getting a decision to be made around that rather than not being able to look at the big picture, which was what we felt was going on.
Yeah.
And it was really important to be able to show the evidence around, well, this is what had happened. There'd been a lot of violence in the home. There was a risk of grooming. There was a risk around gangs. There was lots of disengagement with school. And
Yeah.
ultimately, the parents were doing their best, but they were unable to manage that young person or to meet
Yeah.
his needs. And the social worker had to take action and be held to account.
Mm-hmm.
It was a really tough situation holding social
Yeah.
services to account on that, but it was so helpful to be able to actually very simply say, well, look, here is the story.
Yeah.
Now we need to start taking some action.
Definitely. And I think as well, like you said, it was a sad story and that child had to be put into foster care, but ultimately removed from a potentially very dangerous
Mm,
situation. So,
for
positive
everybody.
outcome. Yeah. So, and as well, I suppose, not having to verbally recount to every changed officer or every new person that came into the situation, having that there that they could read and actually digest it as well. And like you said, it just paints that bigger picture then, doesn't it?
Yeah,
So
definitely.
it's a really good to see how that could work in a real setting and how it's had a positive impact. Thank you for
Mm,
sharing it.
thanks.
um so on to slightly lighter subject matter. It's Chroma's 10-year anniversary this year,
Yeah,
as I
absolutely.
understand it. So have you been there for the full 10 years?
No, I've been there for about just under 8 years.
Okay.
Um, but yeah, so we've been going for 10 years, which is really exciting. And as an arts therapy organisation, I think when we first came along, there wasn't anybody really working in the way that we're working in
Mm,
terms of how do we provide quality arts therapies at scale.
yeah.
Quality, that's okay. We can have one really good therapist, great. Scale, that's okay. You can have loads of people doing anything you like, but
Mm-hmm.
quality at scale, that real sweet spot of how do we make sure that the work that everybody's doing is really good, and as well as meeting the huge need that's out there.
Yeah.
And what's kept us going for 10 years and kept us growing for 10 years is the level of need out there, and our real dedication to how do we just keep doing what we're doing better. How do
Yeah.
we increase the professionalization of the arts therapies? There's how do we make sure it's a really well recognized profession?
Mm-hmm.
You've got it's registered with the HCPC. You've got to have your masters, but actually, it's more than just those things. It's about how do we make sure that we present the work really clearly. How do we
Mm-hmm.
make sure that our therapists are doing a really professional service? How do we make sure that we're not just in there, seeing what happens, but we're really thinking about what are the outcomes for these young people? How do
Yeah.
we know if this work is effective? How do we make sure that there's progress within the work? So that's been a huge part of it. And yeah, so suddenly we find ourselves 10 years on, we've got over 100 therapists, we're working across the country, and it's a really exciting and it's a great organization to be part of. We're run by arts therapists,
Yeah.
and so that clinical work is absolutely at the center of all of our, of everything that we do, holding the client at the center.
Mm-hmm.
Though that said, I think probably in terms of what we're holding at the centre of our 10th birthday celebrations are the therapists as well, and just making sure we have a good party to celebrate.
Well, that'd be very important as well. Yeah, of course, and reward all that hard work as well,
Exactly.
and recognise it. It's really important to do that, isn't it?
Yeah,
That's
absolutely.
lovely. So I will be keeping my eyes peeled on your socials for to see what you'll be doing, how you'll be marking that occasion.
Yeah,
I'm sure there'll
absolutely.
be
We'll have lots going out on the social media. We're obviously we're running a big conference for all our therapists. Lots of
fantastic.
CPD stuff, but also that celebratory aspect, and hoping to make sure that features a lot of the voice of our clients. Whether that's the schools or the social workers, but obviously most importantly those young people that we've been working with.
Absolutely. Well, I will look forward to hearing all about that and all about the work that you've been doing and will continue to do for the next 10 years. Jo, finally, what piece of advice would you give to other schools or organisations in relation to their safeguarding? What's your parting kind of words and thoughts?
Yeah, what advice? I think I think having a really open culture is
Mm-hmm.
really important, and having making sure that this is about concerns. Like I said, it's about
Yeah.
sharing that. It's about enabling people to think. It's about having a clear process, a clear audit. Um, but I think probably the main thing I'd say is that safeguarding is really hard. It can
Mm.
feel scary when there's something going on. It can feel alarming. It could be really alarming for staff that when they're dealing with a difficult situation. So I guess the main advice that I'd give is just to make sure that organisations are really supportive around safeguarding
Yeah.
in terms of, and that support can be, you know, having really clear processes is very supportive. Right, I know
Mm-hmm.
what I need to do. There's a clear path, there's clear scaffolding around that. But it's also about making sure that there's a real culture of openness, of learning, of support, that there's supervision or management that's really kind and compassionate,
Mm-hmm.
uh, because it's tough as a member of staff when this comes up, and people need support to manage with things in a professional and sensible way that gets the
Yeah.
best outcomes for the young people. But actually, staff also need support in around the impact of working with safeguarding. When a teacher's had
Definitely.
a tricky situation, I guess my main bit of advice would be, what's lovely, I guess, as an arts therapy organisation is that we're very, clinical supervision is absolutely central to what we
Mm-hmm.
do. And a lot of what we do when we work in schools, actually, we're obviously working really closely with with staff, and we do get used a lot to help the deputy head or the senko or the teacher to just think about those difficult situations that they've been in, and to help provide them with that support. So I'd
Yeah.
say, for me, that having that culture and that um, expectation that when there's a difficult situation, you're going to get the support that you need. That there's going
Mm-hmm.
to be people there for you, both in terms of let's make sure we've done things right, but also in terms of making sure that everyone's all right around it as well.
Definitely. Well, brilliant. Thank you, Jo. It's very, very insightful and really, yeah, just some really great advice and really interesting to talk to you today. Um, Anyone who would like to get in contact with Chroma or find out about the work they do, they can contact them on wearechroma.com. I will put the links and the details in the show notes, so that you can get hold of them should you wish to. But I, for one, am certainly going to be following them on Twitter and finding out what they're going to be doing over the next few months. So it'll be exciting. So thank you ever so much, Jo. It was a real pleasure to have you on. Just lovely to talk to you. And that's all for today. Thank you for joining us.
Thanks, Mel.
Thank you for listening to the Safeguarding Podcast. For resources and more information about our safeguarding solutions, please visit thesafeguardingcompany.com. And don't forget, if you've enjoyed this episode, subscribe and feel free to rate us using whichever podcast provider you use.